I had a patient yesterday that came in with a massive pain error of TMJ. Every time she opened her mouth, every time she closed her mouth, biting, chewing, anything was painful. And that left to TMJ. T stands for temporal, it's the bone of the skull. The M stands for mandible. J stands for joint. TMJ. Now, when people come in and say, I have TMJ, we all have two TMJs. The proper statement is I have TMJ dysfunction. And TMJ dysfunction is where the bone is not lining up properly. The bone is sitting, the mandible bone, which is one bone that attaches to the skull, but we have two TMJ joints with one bone. It's the only place in the body that's way. We have two shoulder joints, but there's multiple joints in between. We have two hip joints, but there's multiple joints in between. This is the only bone that has two joints bilaterally, but with only one bone. So with that said, when you have the TMJ and the tracking is off, so when you go to open your mouth and all of a sudden your jaw does this as you open and close and it's clicking and popping, it's because the joint is not tracking properly. Now there's a disc in there as well, just like we have a disc in our lumbar spine, our thoracic spine, cervical spine in between these vertebrae. And if that disc isn't working properly, and the mechanics are off, boom, you start getting some pain right there with chewing. Now, one of the things that is very helpful for that is to work on opening the chest, work on bringing the head back and some traction and getting that posture better. And then we do some work on the temporal bone, we do some work on the mandible bone, and then we work on the soft tissue here. And inside the mouth, there's a muscle called the pterygoid minor, pterygoid major, and we go into the mouth, put the finger right on that bone muscle. It is right back here, between the top and bottom row of teeth, and we go in there and we'll release that. And man, it's painful, but it is a fantastic relief. If you're struggling with TMJ issues, give us a call, 512-215-4227. There's lots of things that can be done, but getting in there and working that TMJ, loosening up those joints is one of the things that I found to be the most effective and powerful. So with that said, y'all take care, and we'll see you next time.